So the first presentation is from Jason Buckner. So he's going to speak about optimizing ART in children living with HIV and shifting from a PI to a Dolutegravir-based ART regimen.
Hello, ladies and gentlemen. My name is Dr. Jason Bacha, and I'll be presenting a short oral presentation entitled Optimizing ART for Children and Adolescents Living with HIV by Shifting Protease Inhibitor-Based Antiretroviral Therapy to Dolutegravir-Based Antiretroviral Therapy, Maintained and Achieved Viral Load Suppression. There are no conflict of interest to declare. The background for the study is that while DTG is recommended for children and adolescents, questions and concerns exist around the effectiveness of shifting children and adolescents from PI-based to DTG-based ART. Of course, among the adult population, there is a growing and supporting body of evidence showing this strategy is effective, but again, the data amongst children is currently lacking. We therefore looked at children and adolescents across the BPI network who were shifted from PI to DTG to see the effectiveness of viral load suppression. For our methodology, we did a retrospective review at 7 sites in 6 countries over a 4-year period from 2017 to 2020. We included children aged 0 to 19 who shifted from PI to DTG-based ART. We also defined viral load suppression as a viral load less than 1,000 copies. And of note, during the time period, routine HIV genotyping was not available across sites. Overall, there were 1,475 children and adolescents who were shifted from PI to DTG-based ART during the study period. This is a quick snapshot of the clinical characteristics of this cohort. We can see they were older, adolescent, ART experienced, and the viral load suppression rate before DTG was 88.9%. Clinical outcomes were quite good. We had 97.4% of our patients who remained active in care during the study, and the overall viral load suppression rate post DTG was 89.8%. We wanted to compare pre versus post, and amongst the entire cohort, we saw there was no statistically significant change, no loss of viral load suppression overall, nor when looking at those only on lopinavir or those who are on atazanavir. Looking at some disaggregated data, similar results were found for females and males. Again, no significant loss of viral load suppression. We also looked by age groups and again by prior PI regimen, and throughout the age groups, again, viral load suppression was maintained. There was no significant loss amongst any age groups. One question we're also curious is if any additional viral load suppression was gained, and we had 118 patients who were unsuppressed, and of them 67.8 became suppressed by using DTG. Of note, we also noticed that our females and our 15 to 19-year-olds had lower rates compared to males and compared to other age groups, regardless of PI or DTG. In summary, we found that shifting from PI-based to DTG-based ART was effective at maintaining and achieving viral load suppression in our cohort. These results support programmatic efforts to shift children and adolescents from PI to DTG-based regimens safely, and especially if unsuppressed on PI. We do realize that continued attention and targeted interventions to achieve viral load suppression are needed for females and for the older adolescents. I thank you for your attention and time, and if any questions about this study or the data, here's my email and contact information.